I know we've covered a lot of different subjects in our reading, and I think one of the problems with online courses is you sometimes lose something when you're reading it. And what I have found is that students understand a lot, but one of the things that they seem to miss is psychosis. I asked a question once about a case study. A patient comes into your office and he's delusional and psychotic, and what do you do? And the answer that I got was Risperdal 3 milligrams twice a day. And so I thought, right, and hopefully he doesn't kill himself and others. So I wanted to talk a little bit about psychosis and schizophrenia, bipolar, PTSD, it all fits in, but from a psychotic slant. When is a patient psychotic? When he's delusional, when he is not not well equipped with reality. We sometimes ask patients, do you hear voices? Actually, we always ask patients if they hear voices, and they say no, but you have to observe them, because sometimes the voices are actually telling them not to say that they're hearing voices. So we have to be real careful about that. So if a patient comes in and, well, let's start with schizophrenia. Schizophrenia usually begins at somewhere around 15, 16 years old, up to about 25 years old. Boys are younger. Girls somewhere around 20 maybe, but it could be anywhere around that age. They say that there are some cases of children's schizophrenia. I don't know if I believe that. There can be later onset schizophrenia. Schizophrenia is only diagnosed when the patient has had the signs and symptoms of psychosis for more than 6 months. So when the patient starts with psychosis, you call it psychosis NOS or delusional disorder, or whatever it might be. So how many reasons do we have for psychosis? Aside from schizophrenia, there is drugs, PTSD, major depression with psychotic features, delusional disorder. So when someone comes into your office and they have some disorganized speech, and they don't seem well connected with what you're asking them, you have to wonder, and you have to ask them, are they hearing voices? But again, hearing voices doesn't always cover it, so you may have to ask them a lot of other questions just to see what's going on. And you might send them to crisis, or you might have someone take them to crisis, or you might call the police and have them brought to crisis, or the ambulance. But you have to remember that from the time that patient comes into your office, you're responsible. So if you have, say, a 16-year-old that has very disorganized speech and does not seem to be well connected with reality. And you send him out with his mother, and he, jumps out of the car as they're going down the road. You're responsible for that. Because you have to evaluate them and see if they're safe at all to leave. And that includes much more than just asking, are you suicidal, are you homicidal, do you hear voices? Lots of times when people hear voices, they will say that they've been hearing voices for years. And then that does beg the question, then why did you come in today? And the one thing you need to know is, are they command hallucinations? But even if they're not command hallucinations, they can turn into command hallucinations. If they're scaring the patient enough, or the patient is scaring his family enough that they've brought them into you, then you have to take it very seriously, because something is different and something is wrong, and you need to get them over the crisis and possibly get them inpatient. After that, then you can think about how much Risperdal, how much Zyprexa, what exactly you're going to give them. But for the most part, a first break will require hospitalization. The first time somebody starts hearing voices, they will require hospitalization. You may also run into patients in your field that are schizophrenic, severely, persistently, mentally ill, and perhaps the family brought them in because they're not doing so well medically. Schizophrenics are very well known for not getting medical care. So they can come in, most people come in when they feel a little bit sick. Schizophrenics end up with pneumonia before anyone notices. And sometimes they don't want to come in then because they are still uncomfortable. So let's talk about, let's go back to schizophrenia. Before a patient has a first break, they have what's called the prodromal period. And that's a very vague time. But basically, what people say is when they find out the patient has had a schizophrenic break, they will say, oh, I'm not surprised. And the reason they're not surprised is because that prodromal period, they've been very odd. They're a very odd presentation. They've been doing odd things for quite a while. And so when they start hearing voices, it is not a surprise for anybody. So know that. They may be hearing voices, as I said, and may not tell you. And then they have the first break. If they have no insight into their break, that's very troublesome. It is very hard to get somebody to take medication if they don't think there's anything wrong with them. I recently had a teenager that this was inpatient that kept saying to me, why are you keeping me here? And I said, your thinking is not clear. And I said that every day to him, and he would count his pills and decide if he was going to take his medication. So after about 12 or 13 days, and he was on the medication for that long, he said to me, why are you keeping me here? And I said, because your thinking is not clear. His reaction was that he got very upset with me. It was a very different reaction. And what I realized was that he was getting better. because he was realizing what I was saying, and he was asking me, why do you think my thinking is not clear? And I told him, just like I had told him other days, but this time he got it. So I knew he was getting better. But for those first almost 2 weeks, some days he would take his medication, some days he would not. Now another teenager that I had inpatient didn't want to take any medication, was very stressed that he was having his first schizophrenic break. But his father was schizophrenic, and so he knew what this was all about, and he did not want to be like his father. But he was just so stressed by it. And I finally convinced him to take medication, and his father wouldn't take medication. That's why his father was so disorganized and so out of control, and ended up doing dangerous things to the public, actually. So, but my point to you is, these are emergencies. These are not things that you start them on medication and then treat them, or you start them on medication and make an appointment with psychiatry. These are emergencies. Probably more than 90% of your other patients that walk in the door. So you must take care of it. The other thing I'm seeing a lot of is psychosis caused by wet, which is marijuana soaked with, I think it's formaldehyde. And the patient is so disorganized and so out there that they need to go inpatient. And it might be that mom might say, oh, well, he always gets high, he always looks like this, you know. But you can't let that go by, because they too can cause damage to themselves or to others. And there's another drug called K2, and I recently saw someone that had taken K2, and their presentation was a little bit different than wet, but their EKG was extremely abnormal. It showed an acute MI, and primary care came in and looked at the patient and said, oh, their heart's fine. They did, they did enzymes. I looked at the CKMB, and according to the primary, this is temporary and he'll get better. I don't know if that's true or not. I just knew that he was psychotic and, again, dangerous. The first patient that I talked about, he, when he would take his medication or not take his medication, at one point I was sitting on the other side of the room, and the therapist said something to me, and the patient said, you are transmitting answers to her. And so that's typical of schizophrenics. The TV is giving me messages. The sign is, the billboard is giving me a message of what I need to do. So you have to be very careful and make sure you treat this. Depressive disorder with psychotic features usually is not as disorganized, but they do hear voices.